My father had breast cancer, and he passed away in 2007, and so that's what prompted me to go ahead and get tested or screened. And I have a friend, a female friend, and her mother had breast cancer when she was in elementary school, and then it came back when she was in middle school and her mom passed away.
We don't know the cause of breast cancer, but we definitely know that some women are at higher risk than others. So we'd like to find these women before their cancer is diagnosed so that either they can be counseled about a genetic mutation through the genetic counseling program and find out if they're at very high risk, or if we can do monitoring and walking with them through the care of their breast.
The high-risk breast and ovarian screening program is a specialized program that identifies women that are at a higher than average risk of developing breast cancer or ovarian cancer.
We developed the program because we recognized that there was a void in care for many of these women and a need to partner with them.
The program is operated by specialized nurse practitioners as well as certified medical genetic counselors. We identify women that are at a higher than average risk of developing breast cancer based on either personal history or family history.
Some family histories are rather extraordinarily very young ages at onset or a combination of different cancer types. And for those individuals, we are concerned that there might be something inherited that is making cancer in that family much more likely.
So my friend is kind of how I was in the beginning. I was young, probably early 20s, when my OBGYN started to recommend after I disclosed my family history. And she found out about my father. She really pushed for years for me to get the screening done, and I was young and I put it off until I was 28. And I just felt it was time. I had a child by 28, and I just wanted to take charge of my health, so I went ahead and did it.
Teaching women how to do their own self-exams, self-breast awareness is very important, and that's something that we describe in detail and make sure that a woman feels confident doing on her own. It also involves clinical exams twice a year, which is a little bit different than the average risk woman who would only have an annual clinical exam. One of those clinical exams should be done in a high-risk screening program, and often the second one is done by the patient's primary care provider or their gynecologist.
So for instance, if a woman had a mother who was diagnosed with breast cancer at 50, we would absolutely start her at age 40. Or if a woman had a sister who was diagnosed with breast cancer at 38, we would begin her breast cancer screening at 28.
We certainly recommend annual screening mammograms, and despite some of the other recommendations out there by some of the primary care organizations that will recommend mammograms every other year, a woman who is considered at high risk should have a mammogram every year.
The benefits of having this wonderful program for women is to help guide your risk factors to me. And because I was high risk, to get into that program, and then of course it did find my cancer much sooner than it would have been found had I not been in.
We have just a great resource here in our breast surgery group, our nurse practitioners, the genetic counselors, the social workers. We have education centers and also nutritionists and naturopaths that help people with a cancer diagnosis or those at very high risk.
When a patient comes to see one of the genetic counselors, they should expect a thorough family medical history questionnaire, which includes asking questions about their parents, their siblings, grandparents, and even first cousins. We also ask about what types of screening they've had, have they had any breast biopsies or breast surgeries, other factors that may contribute to their breast cancer risk.
One of the best ways in the door is a physician referral, because some insurers will only pay for visits if a referral is in place. People can, though, call in to learn what we have available. We're happy to see anyone with questions or concerns about their high risk of cancer.
I want anybody who is potentially high risk to definitely get screened and proceed in the best way they feel. And hopefully it's to go ahead with the preventative measures, because nobody would like to live a life of regret.